pleased to open a general discussion with our eminent speakers and guests, Professor Claudio Azzolini, Dr. Francesco Gionni, and Dr. Paolo Asoni. We will exchange our perspectives on the implementation of e-services under the framework of telemedicine, especially in our African communities. Professor Claudio Azzolini, you have the floor.
Thank you very much. Thank you very much for the question. I answered with some concepts that we have. We know that digital medicine is a rapidly growing field in medicine, and telemedicine is the subset of digital medicine. I would like to open another type of discussion. To do healthcare, we need, of course, a physician, a patient, and a lot of people inside. You need a technician, lawyers, you need nurses. Nurses are very important, one of the most important person in giving in healthcare. So we are speaking about caregivers. And on my right, there is a man whose name is Dr. Paolo Asoni, very clever, that he thought some years ago, why don't I have to do some software for nurses, not for physicians, for the patient, for nurses. And if you think, the nurse is he who near the patient, most near the patient than a doctor. What do you think about this, and what you succeed in doing in your reality?
Yeah, thanks, Professor, for this question. We strongly believe that healthcare is teamwork. No? In any team, you have different roles, different players, and obviously there are like the super famous forwards that in this case would be like the physicians, but you also need to have like a workhorse in the midfield, people that are actually caring and continuing the care for the patient. These people are usually nurses, yes. And nurses are, as you mentioned, these people that they take care holistically of the patient, like they make sure that not only the operation or the treatment that they are going through is successful, but also overall the well-being of the person is supported during this important phase, especially if we think that our population overall is increasingly aging, is increasingly chronic, and there are a lot of chronic diseases, unfortunately, that are taking place in our society. So, to have a person that is actually beside the patient and can help the patient with compliance, with strictly adherence to the protocols is actually very important. This is why, and we find that these operators are usually not very supported from a technological point of view. Everything is focused either on the doctor, on the physician, or on the patient. But the supporting roles, let's say in this way, are not usually helped out, technologically speaking. So we try to create like a framework, a decision support tool that actually helps these people to do their job more efficiently, better, in a way that reduces the workload that they have to do in terms of organizations, planning, organization of the work, and they can actually spend more time in front of the patient, trying to understand what the patient needs, what the patient desires, and all this kind of situation where actually helps the overall target of any healthcare system, that is the health outcome on the patient itself. For example, we had cases where it was very useful, at least in the patient's life, to actually take care of other businesses, like, I'm in the hospital, the operation, for example, went really well, but I cannot really speak to my niece or my nephew and let them know what's going on. And for them, that was creating a lot of psychological distress. And that obviously wasn't helping the overall situation, because we all know that to have a full recovery, you also need to have some peace of mind in a way of what's going on. So just simply to help the nurse to actually create this connection with the family and to create this overall conditioning with the patient is feeling supported and feeling like pampered in a way, is actually helping a lot the overall success of the healthcare system.
We understand very well the point of view of the patients, but what about the nurse? Do they accept them? Do they accept this new paradigm? What's the feel of nurses on this new software?
Usually nurses are our first supporters. They love the fact that they have something that's helping them. And they, most of the time, I mean, structurally there are a lot of problems, no? Because there are very few nurses, like physicians, and these nurses are usually overwhelmed by the amount of tasks, amount of planning they have to do for each and every patient. So sometimes they feel like underwater, no? They feel like, oh wow, I have to do a lot of things and nobody's helping out. No, I have to do everything, sort of attitude. Like this, instead, if they find an instrument, a tool that actually helps them in thinking better, spending more time with the patient, they actually feel like protected. They actually feel like supported. And that goes a long way, because then they see that the institution, for example, the hospitals or the local trust is helping them. So they feel like, okay, so I need to give something back. No, so it's a sort of virtuous circle in which the nurse and the institution are supporting each other. So that is actually, they are our first fund. So we are very happy about that.
Find that institutions may support you.
Yes, I mean, absolutely. I mean, we find that, as we were mentioning before, everything is a teamwork. So to actually work properly, you need to find the institution that supports this kind of growth, because anyway, it's an operational and organizational and competence-wise growth of the institution. And on the other side, you need to have the nurses themselves, that they have to be open for growth. No, they want to improve, they want to get better, they want to give better care, they want to give, they want to achieve better health outcomes for their patient.
The number of patients with chronic diseases is growing up, you know, and the number of physicians on the opposite. So we need this, we need that nurses take care of patients in this way, and we are very happy about what you have done. Do you have any comments?
Yes, I think this is also, if we try to project it in what we were discussing about telemedicine framework, right? This is coming even more important because the first goal of telemedicine is to really expand and scale the ability to reach remote location, remote countries, remote areas where patients do not the right level of access of care, right? And the systems to manage nurturing, that is the primary support to patient and so on, that can really accelerate and help also from a telemedicine perspective, because you can really, at the end, those are the ones that manage the patient locally, right? So. And this is something that can be really an evolution of how you interconnect the dots and be part of a full telemedicine framework in the future.
Yes, correct. I mean, the healthcare and telemedicine overall, like, I find them like piece of puzzles, no?
Yeah.
I mean, you need to have all the pieces of the puzzle to actually have the full image, no? And this is why it's very important to have this interconnecting interoperability of systems that they cover the different aspects of healthcare. And these problems are not like just far away fetched, because actually, if you think, for example, at what you were mentioning, like so managing like far away patients, you also have the situation in Lombardy, Like you have this super rich center like Milan, very populated with a lot of people, but then like an hour and a half drive away from Milan, you have these mountain valleys where it's actually very difficult for people to actually go there and give care to people that live in this area. So it's not a faraway problem. It's actually a problem that we can all see close to our areas and environments. Connect the dots. I mean, when you were mentioning about regulations and things like that, that's also an important point, no? Because you also need to create like a framework in which all these technological pieces are included, but also that are on a strong foundation, regulatory foundation, in which you think about preserving data, making sure that the data stays private, and everything is interconnected in a way that you don't lose information, but actually you use all the information to create new information. Because as we were talking before, like sometimes you create a lot of data points, but then it's very difficult to actually have an overall view of all these data points. So being able to actually recognize what's going on is not just having like a few data points, but actually having many data points and the ability to read all these data points all together.
Thank you. Sure. I have many institutional meetings, and I would like to explain to you why, according to me, there is another key barrier, a very strong key barrier, is that the politician usually he want to see results in 1-2 years. That's the main problem. So in a lot of projects they say, okay, I see results in a couple of years. No, you see results to prevent diabetes in 5 years. Oh, sorry, so it's not my, you know what I mean?
It's not my business.
It's not my business.
It's not happening in my political life.
And so this is a key barrier, a great key barrier. Wait.
No, yeah, I agree with all the points you were making, and I agree with the fact that AI is a great tool, is something that will be, probably the most important advancement in the next 10 years, but also needs to be, regulated in an intelligent way, just to make sure that small nations or patients that are not covered by the main centers are actually receiving an equivalent care, no? Because otherwise what's the progress if the process doesn't go to everybody, no, in a way. We need to make sure that as much as possible, it's not a perfect word, so I mean, we should not aim for perfection, but as much as possible, we should, make sure that it's rolled in for as many patients as possible. So yes, and for as many professions, so physicians, nursing, and all the different other professions in healthcare.
Thank you.